All right, welcome everyone. Today we are diving into a really fascinating article. It's by Molina and his team from the International Journal of Periodontics and Restorative Dentistry. And believe me, they're introducing a technique here that could genuinely change how we tackle some of our toughest restorative cases. So let's kick things off with a question I think every single one of us has faced in the clinic, right? How do we handle those teeth that are just structurally compromised, a ton of tissue loss, and they need a root canal? You know the traditional way has its pitfalls, and that's exactly the problem this new approach is designed to fix. Okay, here's our game plan. We'll start with the problem itself, the compromised tooth dilemma. Then we'll get into the new protocol and how it works. After that, we'll look at the real-world benefits for us clinicians and wrap up by thinking about, what this could mean for the future. All right, first up, the compromised tooth dilemma. Let's really dig into why we even need a new way of thinking about this. The article really hits the nail on the head here. These teeth with a lot of tissue loss, they're just so vulnerable. I mean, you're constantly worried about fractures, getting a good rubber dam seal can be a nightmare, and then there's the ever-present risk of bacterial contamination, especially when we're counting on a temporary that, let's be honest, can leak or just pop off. And this is where the big shift in thinking comes in. Think about it. Our default is usually endo first, then rebuild the tooth. Right? Well, this technique completely flips that on its head. The idea is to build a solid, definitive foundation before you even start the root canal. It's a total reversal of the sequence. Okay, let's move on to section 2, a new Pre-Endo Protocol. This is where we see how they tackle all those challenges we just talked about by, completely rethinking the entire workflow. So, the whole technique really boils down to two core ideas. First, you reconstruct the crown before you start the endo. And second, and this is absolutely critical, you seal the dentin right away, protecting it from the very beginning. And that brings us to this concept they call immediate endodontic sealing, or IES. Now, we all know sodium hypochlorite is our go-to for disinfection, but we also know it can be pretty rough on the dentin matrix and really mess with our bond strengths. Well, IES gets around that. It creates a protective hybrid layer before any of those irritants even touch the dentin. Pretty clever. So what are the guiding principles here? It really comes down to control and preservation. You're trying to save every bit of tooth structure you can. You're giving the endodontist a perfectly sealed, clean environment to work it. And the end goal? Making the whole process, from starting the root canal to cementing the final crown, way more predictable and a heck of a lot more efficient. All right, section 3. Now for the fun part, the reconstruction technique explained. Let's walk through how this actually looks chairside, step by step. Okay, the sequence here is everything. You absolutely have to follow the steps. First, you isolate, get everything clean, and seal that dentin with IOS. Then, if you've got deep margins, you elevate them. After that, you build your core. And only then, once you have this brand new, stable reconstruction, does the endodontist go in and do their thing right through it. And this is a really important point. This isn't just freehanding a buildup. The whole process is guided by a digital wax-up. That digital plan allows you to 3D print a guide, which means your coronal buildup is going to be perfectly shaped with the exact amount of space already blocked out for the final crown. No guesswork involved. So let's look at the hands-on steps. You start by protecting the canal orifices, maybe with a modified microbrush like they suggest. Then you do your normal etch and bond protocol. After that, you grab that printed guide and use it to build up the core with composite. And here's the best part. As soon as that's done, you can finish your prep and take the final impression right then and there. No temp, just straight to the lab.
Okay, on to section 4, key clinical benefits. Let's talk about this so what. Why should you actually consider doing this in your practice?
Benefit number 1, and this is a big one, is you get incredible control over contamination. I mean, by creating a sealed, solid buildup from day one, you practically eliminate the risk of bacterial micro-leakage from saliva. And we all know that's a huge weak point for traditional temporary restorations. Next up, bond strength. That IES protocol we talked about, it's a total game changer here. It basically neutralizes all those nasty effects of sodium hypochlorite on your adhesive interface. What does that mean for you? It means you're preserving the integrity of your bond, which leads to a stronger, more durable final restoration in the long run. And let's talk about workflow. This is just a massive advantage for practice efficiency. Think about it. You take your final impression right after you do the buildup. That means the lab can get to work making the crown while the endo is being done. The waiting game is over. And that efficiency directly impacts the number of appointments. A case that might have taken 3, maybe even 4 visits, you could potentially get it done in just 2. That is a huge saving in chair time, and believe me, your patients will love you for it.
But wait, there's more. There are a bunch of other clinical pluses here. This whole approach makes things like deep margin elevation way more predictable. It makes placing a rubber dam a breeze. And for the patient, they get a much more comfortable and better looking tooth to walk around with during treatment. All while, and this is so important, you're preserving that critical tooth structure to maintain the ferrule.
All right, last section, future of endodontic restorations. Let's zoom out and think about the big picture here.
I think this quote from the authors really sums it all up perfectly. With this novel technique, the possibility of contamination and degradation of the adhesive interface is greatly reduced. It really is all about reducing risk, right? You're stopping contamination and you're protecting that bond to get a foundation that's just built to last.
And this wasn't just a theory they cooked up. The article is packed with fantastic clinical cases, both anterior and posterior teeth. They show you step by step how they did it, proving that this protocol actually works in the real world on real patients. So it all leaves us with a pretty big question, doesn't it? For these really tough, broken down cases, could this pre-endodontic reconstruction actually become the new standard of care? I mean, the article makes a very, very compelling case for us to completely rethink our old habits. Well, that's it for this one. Thanks so much for watching. I seriously encourage you to go read the full article for yourself. You can really dig into the details of this innovative technique, and I think you'll find it offers a whole new way to look at some of our toughest clinical challenges.